I also want to thank my partner, Rick Lofglass, in this work, and the team. I talk about the team, Emily Grillo and Jen Bokop at the Laurie Tisch Illumination Fund. And when I say team, and when people see the amount of work that they put out, I think people are thinking, kind of a smaller version of the New York Giants. But it's a little tiny team, but they are really, truly small and mighty. So I thank our team and our partners at Edelman for this great work. And of course, Teachers College, represented by Dr. Furman and by the board chair, Jack Highland. And thank you for today and for all of your good work. And now to end the conference, I'm so honored to welcome most distinguished guests, many of you in this room, I know are fans as we are, a national leader who improves millions and millions of lives every day through programs like SNAP, WIC, emergency feeding programs, hunger relief schools, and so many others. I was fortunate to meet Kevin about a year ago when he and Deputy Secretary Catherine Merrigan invited us to screen our film, The Apple Pushers, about the New York City Green Card Initiative for USDA leaders and partners in Washington. And that started an incredible dialogue on food access throughout the country. So Kevin, I turn the podium on to you. And again, we're so honored to have you here.
Thank you very much, Laurie. It's a very special privilege for me to join you all here today. It's been an exciting morning, very stimulating for me, but also very affirming, beginning with those policymakers early. I wish I could clone these folks and drop them into some other communities around the country, even populate parts of Capitol Hill these days. But very affirming to hear both the recognition in cities like this one, arguably the most important city in the United States, recognizing the importance of these food policies in a variety of aspects of life, and then followed up by the panel of some of the top professionals in terms of nutrition and healthcare, again, recognizing the opportunities that we have. As Laurie mentioned early in her remarks at the beginning of the morning, these are not in and of themselves any one solutions, but they are various strategies that we can adopt, and to the extent we can bring them at scale across the country, we really can make a difference. I find myself these days in a very important set of responsibilities on behalf of the country in overseeing the food and nutrition services as well as the Center for Nutrition Policy and Promotion. As I tell the professionals that I work with each day and with our state partners across the country, whether they're the health departments or the social service agencies or the network of thousands of not-for-profit groups that work in the hunger arena, anti-hunger arena, you are doing work that has never been more important in the life of our country, short of the Great Depression of the last century. That we have more people in the United States, in sheer numbers, faced with food insecurity, with hunger, with periods of time, extended periods of time for many of them when they are struggling. And at the same time, we have the coexistence of a major public health challenge in the form of growing obesity rates across the country. These are two sides of the same coin, often not recognized by folks, that they coexist and they interact with one another. So work of the foundation, Laurie's work, this launch today, this initiation of this new center, to me is very exciting because I see us at a time when, again, the salience, the recognition of the importance of these issues is growing. A little bit of background. These days, some 47 million Americans depend upon the SNAP, the Supplemental Nutrition Assistance Program, still called food stamps. I think New York was one of the last states to formally change its name to SNAP. Change comes hard in many of our lives, but 47 million people, 45% of whom are children, age 18 and younger. A percentage of seniors, a about a third of the households that receive SNAP benefits have seniors or people with disabilities in those households. It has a major effect both on the economy, as has been cited across the country, but most directly in the lives of, again, 47 million people. Well, I was meeting with some folks yesterday, interestingly enough, who came to see us, supported by Robert Wood Johnson Foundation and the Pew Charitable Trust, and pointed out to them that some recent research we've done in that 47 million people currently receiving food stamp benefits, they are getting poorer. The percentage of people receiving that benefit just in the last decade who have no income whatsoever coming into their household, or what we refer to as no net income, has increased considerably. And it reminded me of an article that was written by Jason DeParle of the New York Times here about a year and a half ago, in which he traveled around the country for a period of months and found, he and his researchers, millions of Americans literally who have no other source of support. And by definition, the program is intended to be a supplemental nutrition assistance program, when in fact it may be the only strand of a very challenged safety net. So it is more important in the lives of Americans than it has ever been. It's 47 million Americans, 45% of whom are children. So we're very focused on that SNAP program. It is the most inclusive of all of the nation's nutrition programs. Again, never more important than it is right now. Now, some of the policymakers right at the outset in the first panel referred to using policy to really further goals around healthcare, around reducing poverty or reducing hunger or food insecurity. And we are utilizing our SNAP program in a variety of ways to try to both not only respond to food insecurity and hunger, but also to nudge people in the direction of healthier eating. And part of that is taking systematic, part of our strategy in that regard, is utilizing that SNAP program as an example, as a lever to really encourage, to direct, to require the smaller stores, the smaller corner stores or bodegas around the country to increase what we refer to as the depth of stock. There are now 245,000 stores in the United States that process food stamp benefits, 245,000. About more than 80% of those benefits are redeemed at supermarkets or big box stores. So there's a variety of healthy foods available in those venues. But about 18% of those benefits go through small stores. And to be eligible to be a SNAP store, one only has to meet a pretty minimal set of requirements in terms of the stock of food. And I am very interested, and we have proposed regulations that will considerably increase the requirements for depth of stock for those small stores. That alone won't solve the food desert problem, but it will be a major step in the direction of providing healthier foods. And I have an example in that regard to point to, and that is in our WIC program, the Women, Infants, and Children's program, which now, by the way, serves 53% of all of the infants in the United States in the first year of life, 53%, more than 2 million infants per year. We increased the depth of stock requirement for WIC stores, and there are about just under 50,000 such stores 2 years ago. And the effect of that has been not only to provide a healthy array of foods to WIC recipients based on science. This is based on recommendations that came to us from the Institute of Medicine. Isabel was a member of that panel. We took those recommendations and converted them into requirements. We didn't lose a single WIC store in the country. But the effect of that is not only WIC clients or WIC consumers in those neighborhoods, other folks who live in those, who shop in those small stores, they now are more likely to have access to this fuller array of healthier foods. So I'm confident when we finalize the requirements for SNAP stores, we will have a broader impact on not only people who participate in the SNAP program, but on those small, those folks who depend upon those small stores in their own neighborhoods. In the last 2 years, we replaced the food pyramid with what's now called MyPlate. I think a more communicable food icon, something that I see more in many, many places as I travel around the country, food banks, schools in particular, even supermarket chains in the produce section. But we're pushing and promoting that as a way of educating all Americans on ways to eat healthier. We also, in addition, as a companion to MyPlate, have introduced an online system called the Super Tracker that now has more than 2 million regular enrolled folks who interact with that Super Tracker on a regular basis to be able to assess how healthy they're eating. And we're about to announce a Super Tracker for kids. So for school-age kids across the country can engage as well. Now, just last week, we announced our proposed federal requirements for healthier snack foods in schools, so-called competitive foods. We're not allowed to use that term, but it's a way to understand that the foods that compete in the vending machine or in an a la carte line with the healthier meals that may be provided. Well, the National School Lunch Program each day serves 32 million children, but there are in excess of 50 million children who attend school each day in the United States. Well, these new requirements will govern the total food environment in all schools that participate in the National School Lunch Program during the school day. So that will affect the environment, the food environment, for 50 million American children daily. And that is one of the most important steps forward, in addition to the new meal requirements that were implemented across the nation this current school year. I spent much of the fall traveling across the country, visiting schools, eating with school children. And a true story, at the very first week of school in New Orleans, it was the first week of July, I was eating with 2 first graders, one on each side of me, at a school that had just been rebuilt in New Orleans. It was actually within sight of one of the barriers holding back, the waters in that system, rebuilt levees. And I was chatting with these 2 little students who had lots of ideas and were easy to chat with. And one of them finally looked over at me and said, "Mister, if you're not going to finish that broccoli, I'll finish it for you." I threw up my arms and I said, "Victory is ours. Victory is ours." So I know it can be done. These were young children who had gone to preschool in that school system the year before. And I have seen this, the challenge is greater in high school students who have been socialized in a certain way up to these years, but the travels have reassured me in elementary schools and middle schools it can be done, and we'll get to high schools. I've seen similar success in the fresh fruits and vegetables program, and I know New York City schools have a very vigorous, very robust program in that regard. But our program nationally, my only complaint about it is it reaches too few children. It's available only in elementary schools, and only in elementary schools that have the highest percentage of very low-income children. But in those schools, again, we hear from both teachers, I've observed it with students, it makes a difference. So I know all of these are examples of saying a policy deployed that reflects our best professional thinking, scientifically based, can make a difference on some of these issues of both reducing hunger and food insecurity, but also doing it in ways that encourage American children early in their lives to eat healthier. These days, we have our eyes on Congress, in our case, in terms of financing and funding. As you heard earlier today from Mayor Booker, his direct experience in testing and trying the SNAP program reinforced for him the importance of it, the importance that the program is needed. As I mentioned, many, many millions of people, it is their only source of any kind of outside income. What used to be the TANF, or what is the TANF program, what used to be AFDC, the Cash Assistance Program, serves a much, much smaller fraction of people, thanks in large part because it has been block granted. And so we're very resistant of even considering block granting the SNAP or the food stamp program. I think would be a horrendous idea. And in examples of, thank you, even locally here, recently, when the hurricane hit, the state agency, the city was able to, and in the border states to here, were able to reissue benefits for the month that the hurricane hit, and then was able to, in selected zip codes, issue what are called disaster SNAP benefits. And if the program were block granted, it would be nearly impossible to do that, because the implication would be where would the money come from to really respond to these greater crises. So we're very focused on that. We're very focused, obviously, on the importance and the efficacy of the SNAP and food stamp program, but it's partnered with those child nutrition programs in schools. You know, increasing number of American children have breakfast at school. The early research on that is very, very encouraging as well. In excess of 13 million children now have breakfast at school. I mentioned the WIC program earlier. Its reach in those school-based programs, breakfast and lunch, the guidelines we use to require schools for the meal patterns are based on recommendations to us from the Institute of Medicine based on dietary guidelines. And a week ago in Rockville, Maryland, we convened a group of nutrition experts, healthcare experts. For the first time, we're working directly with our partners at the Department of Health and Human Services to recommend to the country dietary guidelines for children from birth to the 24-month, or so-called B24s. When my staff first used that term with me, I thought they were reflecting on old war movies, but it's a term the health professions use. Kids from birth to the 24-month age. Right now, there are no formal dietary guidelines nationally for that age group, and we're moving into that space, obviously continuing to promote breastfeeding and to try to create additional incentives in that regard. So we have the good fortune to be able to use these policies to reinforce sort of enlightened research or practices that can make a difference in the lives of Americans. We recognize today the launch, the initiation, the inauguration of this new center as one more very important ally in much work that needs to be done. So we thank you for all the great things you're doing here in New York, and thank you for inviting us.
Thank you so much, Kevin. I loved your story, although I'm a little older than the first grader, so I admit I probably would have asked if I could finish your French fries, but but I'm getting there. So I thank you all, especially to the panelists, the participants, the organizers, and to everybody here for spending your Valentine's morning with us. I hope your evening is equally exciting, and that you have a wonderful dinner. You cap it off with just a little piece of chocolate, not too much. So happy Valentine's Day to everybody, and thank you so much. And we look forward to seeing you same time next year with lots and lots of positive results.